Uh, Meet Liam, a 6-year-old boy. He wakes up sneezing, rubbing his ears, and his night is characterized by snoring and persistent episodes of waking up with a cough that is non-productive. He's struggling to breathe with his mouth because he feels his nose is blocked. His day is filled with congestion and constant throat clearing and constant episodes of coughing. Excuse me. And he also has muffled hearing. His parents think that this is another recurrent episode of a cold, but this is something more. This is an allergy. How many children suffer like Liam without knowing the real cause? I'm Dr. Joshua Delito, a family physician. I have interest in public health, cancer prevention and treatment. In this video, we are going to look at common allergies in children and their effect on the ear, nose and throat health for children. We are going to look at what are allergies, common triggers, what are some of the possible complications, and so what are allergies? Allergies are immune systems overreaction to harmless substances triggering inflammation and discomfort. Generally, the body is supposed to react to any foreign body that or any foreign protein that is presented to it. But sometimes you may have the reaction goes above overboard. So it's like your body hitting the panic button for no reason. And out of this, then you have a negative effect on the body rather than the protective effect that the reaction is supposed to have. So what are common allergens affecting children? Allergens are those molecules that trigger these allergic reactions. And usually they could be outdoor. We have allergens like pollen from flowering plants. We also have mold like from things that are decaying or places that have been wet. We also have grass, especially when it is flowering. Could be a source of irritation and the allergic reactions. Then we have indoor allergens like dust mites. Dust mites are unseen growth found on beddings or clothes that have been packed together. You can also have pet data from animals for those who have cats and dogs in the house and also other animals. Then you have normal mold from things that are decaying. We also have food allergens like dairy. Some people you have allergy to milk, to eggs, sometimes to nuts, mostly meats also. They are usually proteins from animals and also sometimes plant proteins. Then we have environmental irritants like smoke, pollution. We have perfumes. We also have dust. We have smells. These, or when some people are exposed to them, then they tend to get either they start rubbing their ears, they may start sneezing, they may start having a running nose, and those kind of reactions. So how do allergies affect the ear, nose and throat health for children? We have the ears, and the ears are affected mainly not because of the allergen but because of the connection between the throat and the nasal opening and the eustachian tube, which is the opening of the ear at the back of the throat. And you find that because of this hyper responsiveness, there is increased secretions, especially in the eustachian tube, and out of this then you have fluid buildup in the middle ear, which can cause accumulation of fluid in the middle ear, and this also makes hearing difficult. Then you have the nose. You can have a running nose, you can have sneezing, you can also have a persistent postnasal drip presenting as a persistent cough because of the irritation at the back of the throat. Then over the throat region, you may have sore throat, you may have hoarseness, and a chronic cough. Usually the cough is persistent, it is non-productive, and it is very irritating. Then you have the eyes, they may become itchy, they may have discoloration, they may become red, and they also may have watering. So these are some of the commonest presentation of allergies in children. So how do the children present with these allergies? They may have a running nose always, and the mucus from the nose is usually light and whitish and watery. They may have persistent and recurrent ear infections because of the blockage and the increased secretions, which also make a good environment for bacteria to grow. Then you may have persistent throat clearing. They are always trying to clear some mucus from the back of the throat, especially if they have the persistent postnasal drip, which is a consistent drainage of mucus at the back of the throat. Then you have hearing difficulties. I've talked about this because of the accumulation excuse me, because of the accumulation of fluid in the middle ear, and this can be very irritating. So how do you make diagnosis of allergies in children? Usually is from the history and the symptoms. One, there is the timing. You'll find that if it is a cough or a running nose, tends to come about at some particular times of the day. You may find that the children, they have a running nose either very early in the morning or late in the evening when it's a bit cold, and they may also have a running nose around this time. Then there's also the seasonality of the symptoms. They may happen often around when it is during the rainy seasons, during the cold weather. When it is dry, depending on what is the allergen, then they are very okay. For children who have allergies to dust, then you find that they have no problem during the cold weather when it is rainy. But now when it is dusty, then the problems come in. You may also find patterns that a child will have a problem when it is at home because of possible presence of pets in the house, but during the day when the kid is at school, he has no problem. It could also be like he has problem because of in school because of possibly where they use chalk because of chalk dust, and they start sneezing, they start having a running nose. Then so the presence of triggers will stimulate the presence of the symptoms. Then when you examine the child, you may find that they have hyperemia or redness of the nostrils, and they may also have enlargement of the nasal turbinates, and when you look at the back of the throat, excuse me, they may have a persistent postnasal drop. And where you have the capability, you can do the skin prick test for various allergens, and this exposure will stimulate the action. And then you have, for chronic cases, you may have to do postnasal space examination. Either you can do a laryngoscopy or a direct visualization of the throat. So common complications of untreated allergies. For the ears, you have chronic ear infections. Because of the persistence of the infection, they may have ear discharge with pus or recurrent ear infections. They may also have hearing difficulties, especially if there is accumulation of fluid in the middle ear. Then you have sinusitis causing because of the recurrent infection of the sinuses, and also there is persistent nasal blockage. They may also have nasal polyps, and some kids tend to also to develop adenoids due to the persistent irritation of the nasal nostrils. Then they may have a chronic cough which is persistent. They may have speech delays. There is also speech difficulties because of the problem with hearing, and also because of the nasal blockage. These kids, they talk from their nostril, and you hear that the voice does not come out as well as it should. Then of course there is the issue of sleep issues. They have poor sleep, they wake up tired, they have poor school performance. Mainly because many times they tend to miss out on school, either because they have an allergic reaction. Remember, these kids who have ear, nose and throat effect of allergies, they may also have to have lung congestion, and they may also have other effects on the skin. These are the kids who are more likely to get eczema. And so they may also have asthma, and so they will miss out on school, and also their speech may be delayed. And so because of all these things, then they may tend to perform poorly in school. They miss out school a lot, and also because of the persistent symptoms. And a kid who is always having a running nose, they may tend to be isolated and left out by other children. And these are some of the social complications of these allergic issues. So how do you manage the allergies? One is identifying the triggers. Of course, trying as much as possible to keep the children away from the triggers, and then using air purifiers. This is a point that may need some discussion, because there are some schools of thought that think that keeping the environment overly clean and protecting these children from exposure to some of these allergens has been a cause more than a prevention, such that you find these kids, we tend to overdress them, we don't allow them to be in good environment, we don't allow them to exercise, and this makes them more responsive, and they get more triggered. And we also tend, parents are advised for kids who have allergies to some food that they avoid some of these food like milk, dairy products, nuts. But there are studies that have shown that kids who get exposed to some of these things like milk or eggs or nuts from a small age, some people talk about 3 months onwards, you wean them as early as possible before the allergic reaction starts, especially kids who have eczema. Exposing them to some of these allergens at early stages helps them to cope up better than those who have been kept away from some of these allergens. Then the other thing is for those kids who may have allergic reaction to cold or dust, we tend to be more overprotective. The kid is overdressed, the kid is kept away from cold and any dusty environment, such that the kid does not have time to play with the colleagues. And some of these practices, they tend to be more detrimental to the child more than helpful. So you need to strike a balance, that do not restrict your child so much. Allow him to play with other kids, allow him to be a normal kid. Just encouraging him to keep warm, preventing the preventive medicine, especially for those who have persistent and recurrent things like sinusitis. Just puffing them and allowing them to go and play with the other kids will help these kids to keep healthy, and will help them from having recurrent attacks. Because the more we try to isolate them, the more we try to secure them, the more we make it difficult for them to cope up with some of these things. Then of course I've talked about using the preventers, drugs that they can spray to their noses, which help to prevent the attacks. So you can use antihistamines as medication, nasal sprays, and also sometimes allergy shots if the allergies become so recurrent. Of course, always trying to make the house clean, trying to arrange the child's room well, having no clothes that are put together for a long time, making sure that the room is well aerated, the windows are open, and this will help fresh air to come in. And of course, always, if you have a kid who is allergic and they start coughing at night, always putting the mattress and their beddings outside and making sure that their bed sheets are well cleaned out. So that if there is the mattress, then you remove the dust mites and also the bed danders. Then, of course, ensuring that they have adequate hydration having nasal rinses and maintaining cleanliness. It's always good if your child is always having a running nose. Make sure they have a handkerchief always. They always also keep their nails cut so that they avoid because of the scratching, they may also tend to scratch themselves. And this scratching exposes their skin to Staphylococcus aureus, and Staphylococcus aureus has also been shown to trigger and worsen eczema. Then dietary adjustments, avoiding food triggers, and if you identify that your child is more predisposed to these allergic reactions, then introducing them early enough to some of the food that they may become allergic to later in life. And this acts as an immune booster to help their immunity cope up better than if you completely avoid these allergens. In fact, there are some people who are talking about parents avoiding milk, avoiding eggs, avoiding nuts in pregnancy, but all these things have not been found to work. So their advice is eat a healthy diet. A higher diet is a diet that has whole grains, plenty of vegetables, plenty of fruits, and of course adequate lean proteins. Then those are some of the things that you can do to help your child who is affected by allergies. Then there's of course the emotional impact of allergies in children, and I've talked about kids who have always have a running nose, being isolated by their colleagues. So remember, they also have a feeling, why is my nose always running? And this makes them feel out of place even when they are with other children, and this can make it difficult for them. Then miss school, they have missed classes due to frequent infections and to frequent attacks, making their breathing difficult, making also them more prone to allergic reactions, and this makes them miss out on school. They may also have difficulties with fatigue, irritability, poor concentration because of poor sleep issues, and this affects their concentration in school. You find a kid, because he is not able to sleep well at night, then during the day in class, instead of the child concentrating, he may tend to sleep in class. And so parents might need to be aware about this and try to see what measures they can do. Persistent and the necessary use of the drugs, and of course the necessary environmental adjustments. So how do we empower the parents and the caregivers to take care of these children as health providers? One is early recognition and the treatment of these children to avoid complications. As I've said, things like enlarged tabinets, adenoids, they happen because of the children having persistent allergic reactions, and this enlarges the tabinet. They may encourage the adenoids to enlarge. So having consistent use of the preventive medicine will prevent these kids from getting these complications, and the parents also need to work with the schools so that the school is aware that this is a kid who is having allergies, and the school should be help the kid, one, to cope up with the school environment, fit in with other children, and also it is important to educate the children about their symptoms, and also make them understand that they have an allergy and they know what to do when the symptoms persist. So it's always good also to have regular doctor's checkups so that the kid can be checked out. And if there is a worsening of the symptoms, the parents, the school, and the healthcare provider should work together to know what is not working well, and they can adjust the treatment appropriately to be able to maintain the kid's life to normal as possible. So it is also good to look for allergy-friendly products so that you know the type of soaps that these kids should use, the types of oil, which do not stimulate them to get more responsiveness. So it is important that you realize that allergies are common things, and they are more common than we think. Sometimes we may tend to play them down, but they become a nuisance to our children. And the more our environment is becoming more cleaner, and the kids are not exposed to more of the things that will stimulate their immune system, then the more allergies are becoming a common thing. But there's an observational study that was done and found that families where they have dogs, they are less likely to have allergic reactions because of the stimulation of the immune system to some of these things. But that was an observational study. There are no controlled trials that have been done, but that was a major observation. So as we are moving our environment from the rural areas to more town and urbanized environment, then there is a great change of our environment, and many things tend to change. And so we need to know, how do we adapt to this, and how do we make our kids live as normal life as possible, so that they don't get more episodes of allergic reactions. So with the right care, children can breathe, can hear, and they thrive. So let's create an allergy-free environment for our children, and know how to take care of them, so that they don't live with symptoms and they don't enjoy their life. So I encourage you to share your experiences with the allergies in children. What have you been doing? What are some of the challenges that you have been having, either as a care provider? What are the common presentation of kids that present your service? How do you handle this? And what, as a parent, what have you been doing to prevent allergic reaction to your children? Thank you very much for watching, and I'm grateful. So allergies. Allergies are a common occurrence. It's actually more like an epidemic. We need to know how to deal with them, and I welcome reactions from the audience. What you feel about this topic, especially when we think about our children and the things they are going through because of allergies. So if you have anything that you want to share, comments, questions, I have opened the floor so that we share our feelings and our reactions about allergies. Any concern about common allergens that we have? As I have said, one of the things that you may find very controversial is the issue of introducing children to the foods that they might be allergic to at an early stage as much as possible. Because initially we tended to think that introducing these foods to the children will make them more allergic. But it has been found that kids who are more exposed to what they might be allergic to. In fact, there was a study that was done on peanut allergy. And this was a study that was conducted in Britain, in the US, and in Tel Aviv. You find that Jews use a lot of peanut, and so one the triggering aspect was one of the allergy professors went to Tel Aviv, and they asked in his audience how many of the health providers had come across someone or any of the kids with the allergy to peanut. And to his surprise, it was only a handful of the primary care health providers, pediatricians, and even allergy experts in Tel Aviv who had come across the peanut allergy. And when they looked further, they looked at kids in Tel Aviv use a lot of peanut, and they're exposed to it a lot. And so they did a major randomized controlled study with kids in Britain, in London, and also in USA, all from Jewish origin. Some were exposed to peanut, and the others were kept free from peanut. The kids who were kept free from peanut had more allergies than the ones who were exposed to peanut. And so this early exposure makes it the body immune system to develop its own mechanisms to cope up with these stimulants. And the earlier you start it, the better it is. And especially for kids or families who come from places where they know that they have these allergic conditions like eczema, then they need to expose to the children to these allergens. Of course, also, as I've said in the discussion, infection with Staphylococcus aureus has also been found to increase the chances of kids getting more allergic to eczema stimulants. So it is important that we try to, as much as possible, to prevent the infection of kids with this bacteria because of its negative impact on their health. So in the absence of any question, in the absence of any comments, I think I will close up there. Thank you for watching. I encourage you, if you find this content, please subscribe to the Overall Health channel for more content. You can